moved to Billings in the way I think of recently, and she now serves PLUK, which is Parents Let's Unite for Kids. And she is specifically working in eastern Montana on developing wraparound services for families with children so that those children will have the kind of supports and planning that they need to stay whole and to do well in their communities, which is why I stopped just before we got any further down that path, because that is indeed the issue that Barbara is all about. It's been my great pleasure to know her for several years and to go on KXGN and have her do a little interview, which is available on DVD, which she doesn't know till I just said it. And so in any case, so here's this wraparound 2014 Barbara Thank you for coming.
Well, thank you for inviting me. I always say that I live in Billings, but my heart is still in Eastern Montana. And I grew up here. I have relatives in Sydney and Fairview, Glendive, and all over Miles City. So, you know, I'm really committed to getting this wraparound program going in Eastern Montana because I really believe in it. And I first got started interested when I went to a mental health, Children's Mental Health Bureau conference in 2008. And on a personal basis, I have a grandson that I've been raising, and my husband has been raising since he was 10 years old, and he went to school here. And he's 19 now, and he was in treatment 3 times, and he didn't have the opportunity to be in wraparound. And I just, it makes me feel sad that he wasn't able to participate in this program, because I think it would have made a big difference in our lives. Anyway, I just think there's too many youth that are having behavior problems at home and in school, and too many kids that are failing in school and dropping out or being expelled because of behavioral problems. They get in trouble with the law, run away from home, self-medicate with drugs, and harm themselves. Like we have kids that cut themselves, and our rate of suicide is really high in Montana. 1 in 13 youth will commit suicide. And then families have to travel so many miles to get treatment from this area. So I think wraparound is the answer. And it can keep kids, the whole whole idea behind wraparound is to keep kids in the communities and not send them to, treatment facilities. Wraparound first started in Alaska in 1986, and the reason for that was because too many of the kids were sent out of state, and so they wanted to bring those back and keep them in the community. Let's see, after that it spread to other states, and we're the only region in Montana that doesn't have wraparound right now. And so I'm hoping that there can be enough interest to get this going here. Wraparound is a process for change. It's not a service, and it's made up of 10 principles. That's how it works, and 4 phases. That's what we do, and the theory of change explains why it works. So the phases here start with engagement. We meet with the family. We find out what the family's strengths are, what their needs are, and what their culture is. We honor their culture. We don't want to make recommendations even if it's opposition to their culture. Then we have a planning phase where we develop up a plan, and also we address whether there's a crisis or safety concern. And then implementation stage. Then we go ahead and implement our plan. If it's not working, we don't blame the family or the child. We go back and revisit the whole plan, because maybe something's not working in the plan. So then we have to, talk about that. And then once the child is studying the program called graduation transition, we usually see kids about a year. It can vary, but usually they can transition out of the program. And at the time of transition, we ask the kids, what do you want to do to celebrate? So one kid just recently said he wanted to have coconut ice cream and pizza. So that's what we did. Another family, another gal, she wanted to go to Chuck E. Cheese with her family, and Chuck E. Cheese was able to donate that to our program, so we didn't have to pay the full fee. So lots of times businesses will help out to do that as well. There are 10 principles, as I mentioned, and I think one of the things is that we follow the voice of choice of the family. We, it's family driven, so we meet with the family and decide, all through our meeting, we talk about what the family wants to do, and they have their voice of choice, which is so important to include the family in all that. Also, we include people in the community, like your natural supports, and natural supports can be maybe an extended family member, or it could be a neighbor, grandmother, grandfather, and the family decides what they want. Like the youth themselves could say, I'd like my friend to be there, my boyfriend or my girlfriend or whatever. And so by doing that, I think we're helping the community understand this family, and also to understand the mental illness. And you're not afraid of something, you understand it. Lots of times there's that stigma, the fear, and they understand that, well, all the better. We do integration, and that means we integrate whoever's working with the family, if it's a therapist, a teacher, a probation officer, services, they are on the team as well. And we meet with the team once a week. And so they come in and we get all on the same page. So I remember with my grandson, it was like the therapist would tell us one thing, the school would tell us something else, and they never got together. So sometimes those things were opposing. So by having everybody on your team meeting weekly, we get on the same page, and it makes it a lot easier for the family, And also, if there's any disagreement, that's decided out of the committee. And one of the things is that we set up ground rules at our meetings, and one thing that we always include is no shame or blame. And so I think that's probably one of the most important steps, besides, being honest with one another. It can vary, and it's the family that decides what the ground rules are going to be for that meeting. And besides, integration, we're persistent. We don't give up on the child or the family. They may give up on us, but we don't give up on them. We just hang in there. And then the fact that it's community-based. their, like, if they're in a treatment facility, and so we try to see them right away. And we're finding that we're preventing them from going back. Like I mentioned, my grandson, he went back 3 times. Well, these kids, you know, have a better chance of not repeating that same, you know, procedure. It's very individualized because, like I said, we build on the strengths of the family and their skills. So we, you know, each meeting is so different because they have such different needs. You know, some of them might need housing or transportation before we can get to some of the mental health issues. You know, the family says, we got to take care of this. We can't even think past that if we, you know, they're not getting food on their table, the basic needs met. Well, they're not going to be able to, you know, move on to talking about other issues. And again, strength-based. We build on the family strengths. And lots of times families come in and we want them to tell us what their strengths are. They can't even come up with any strengths. So the more we visit with them, you know, we're able to find more strengths in that family, and then we can build on those. And then it's outcome-based and cost-responsible. So, like if we have Children's Mental Health Bureau, they have a certain amount of money that they can spend through that program, or juvenile probation, they have a certain fee that they can spend. So we try to be responsible as far as, you know, following that. And why does it work? It probably works best because we follow the needs of the family. We don't come in as professionals and tell the family, now, you need this and this and this, and this is how you need to do it. And they tell us what they need. It's very different. The team helps the family build efficacy. That means they learn how the system works. A lot of the families, they're not sure how children's services work. Who to go to, and you know, how to talk to them, where to pick up applications, and you know, we have IEP meetings, you know, how those are being run, so they feel more comfortable, and then we're their advocates. I think another reason it works is because the natural supports are being built. And sometimes families can't think of any natural supports. And so we say, okay, when you have a flat tire, who do you call? If your fence needs fixing, who do you call? If you need a babysitter, who do you call? And your natural supports are reciprocal. Like, you know, who helps you, but who do you help in return? And, you know, we all have natural supports. Sometimes we don't think about it, but I remember our grandson had a teacher that he was retired. He would come and take him to work in his garden. And at the same time, he was teaching him good morals, I guess, or good manners, or whatever you want to call it. And having a lot of fun. And he was helping him, the teacher, with his garden, but yet, you know, he was teaching him, you know, not a good idea to smoke, and, you know, maybe, you know, you should be doing this, and where we as grandparents, you know, don't want to listen to us, but the neighbor, you know, that's a little different. And then again, it's team integrated. That means that everybody's on the same page. And this is kind of my flower that kind of shows how it works, the theory of change. Here in the middle of the flower is the family's needs, and these are their skills. And we just keep building on those skills. And sometimes we need to teach them skills as well. And these are your natural supports. service the care, and they could, you know, they're the paid services that a family gets, like your respite, a therapist, maybe they need a bus ticket to get where they want to go. So that's kind of a brief overview of it, and I want to, you know, leave some questions, time for questions, and
one of the things you mentioned on TV, I'd like you to tell that story a little bit before you take questions and answer them, and that was the depressed girl who the school wanted to get rid of, and then wraparound services happened, and she was the favorite of some teachers and stuff like that.
Oh, yeah. Okay. Oh, I've got so many good stories about the kids that we see. This girl, she probably had more problems than any of the kids that we've had. She was cutting, she was running away, she was using drugs, and she was in a treatment facility. And she was in our program, and then when she first came in, she dressed in black. She had her hair dyed black, and you know, she didn't talk much, but she was very creative, and she would draw. We would have her, you know, her successes up on the board on one of these sheets, and every week her successes would grow. And we do this with all our kids. Every week that we meet with them, we have them tell us what their successes are. But anyway, long story short, she ended up getting A's and B's in school, one of the teachers' favorites, and not only that, but she was helping some fellow students. One of her friends was threatening suicide, and she talked her out. And you know, that was just so exciting. We get quite a few kids from probation, and we're seeing a lot of success there. A lot of the kids have learning disabilities, and they self-medicate, and so they're being picked up for being on drugs and breaking the law in one way or another. And one of our kids now, he just graduated from probation, and he asked if he could. He has the probation officer. He comes to our meetings as well. He asked, "Well, I'm off probation, but I wondered if I could stay and wrap around a little bit longer, at least until you retire." And he's the neatest kid. And you know, all our kids are really neat. They come in, they're afraid, they're a little belligerent, some of them, you know, but after we've had them a while and you find out their stories and, you know, what they've had to put up with, well, you just kind of get to know them. They're really lovable kids.
They sound like they're characters.
They're what?
Characters.
Yes, they are characters. And we see kids, let's see, I think our youngest was probably 6, up to 17. And so we get a wide range of kids. We go outside of the Billings area, but most of the kids we see are right in Billings. And so
how do you get kids referred to the program, and how do you grow?
how do we let?
How do you get kids referred to you?
They come from Children's Mental Health Bureau. That's where they were coming from, and from juvenile probation. The kids that we.
And then how do you grow a program?
Well, we just keep getting referrals, and parents tell one another, and I think as there's more people wanting services, you know, I work for PLUK, and so those referrals will be coming through that way. And it's, you know, we're in the talk about wraparound and not give you all that, but, I'd say, you know, contact PLUK, myself, and, you know, we'll,
Yeah, I was just thinking for kids like in Eastern Montana, you're one to grow into this area.
Yep.
How do you go about being smarter, how do we have to provide your decision
yeah, it's, probably gonna be through PLUK that we grow it.
So calling PLUK is one way that at least once, if not more, Barbara said to every county LAC that there is in Eastern Montana. Yeah, and although I like new things about it, this is the third time I've heard her presentation, so I know she's getting around. Let's take 2 or 3 more questions and then we better move on.
When I first moved here about 20 years ago, I was on children's care manager in mental health. And I remember finding out about PLUK and having someone would come, and I thought they were out of Lansing at that point.
Yes, that's Teresa Mulgrew, and she's still working on there.
Okay.
She, I think, is mainly working with developmentally disabled children, and she has come here.
I got her to come to some of the kids' IEPs and really help the parents figure out that in school and how to get better placement for the child in those different classes and stuff.
Yeah, PLUK has people that are trained just for to go and, attend the IEPs and help parents. And they also, there's 30 people statewide that work for PLUK. And so, some of those people are doing wraparound as well.
And she still does it.
Yeah, she does. Oh, yeah, Lori.
I have a couple questions over here too,
I know that I know Teresa, first of all. They go to church with me, and I know Isaac. And anyway, and Teresa's focus has always been kind of the advocate for that developmental side. What you run into with Miles City, and I know in other places, is you have several wraparound type organizations, like Aware offers wraparound, similar to this. I know YDI is another one, and they've all, because I worked for Aware for 3 years, and this is like, I'm like, oh, that sounds familiar, because that's something that there's a focus on. I know mental health has branched out, our mental health in Miles City has branched out into that sector as well, with the CSCT programs in the school. So I'm kind of speaking toward Belinda at this point, because they have kind of shifted that focus. But I know PLUK has been very, very beneficial in Miles City for kind of getting that process moving. So, and keeping all those organizations kind of honest in their approach to wraparound. So I think that's really good.
Last question. Do I hear enough for a question? Go ahead.
I just wanted to say that, that I am a certified peer-to-peer, and there are 2 positions that are paid that are on the team, and one is the facilitator, and they make sure that all the steps are followed, and, we're both certified, and, you do have to go through a lot of training, right, to be certified.
Right.
And then, you know, you need to follow all those steps. And it's a high fidelity program when you follow all the steps, so it is a little different.
Right.
So before we take this last question from the young lady, another thing that Barbara's doing is going around to the different counties and communities and looking for people who want to be trained. Okay.
I just pretty much want to know if I was to go into, I forget, but anyway, I'll do it. If I was to go in on the internet and stuff, what would be the best place to go to look for PLUK and your organization too?
Yeah, it's PLUK, dot
Org.
org.
Okay.
And mine is Barb, period, do have hand-up material up here if you want, Sean.
Yeah.
There's brochures, and there's also, if anybody is interested in this high fidelity wraparound, this is where you get your certification in order to, you know, high fidelity.
Very good question. Very
Yeah,
good question.
very good.
Thanks for asking. Well, we better go ahead and give Libby her turn to tell us one of the things that you want to know about Libby. One of the things you want to know about Libby is she's got a great sense of humor. When she heard that Barbara and I were going on TV, she said she was going to ask for our autographs when she got down here, but apparently she's forgotten. But Elizabeth Libby Carter is the Eastern Montana Resource Manager for the Children's Mental Health Bureau. And that's in the Developmental Services of the Department of Public Health and Human Services. She was with us last time we had a mental health summit, and we're glad that she's agreed to come and present for us today on the Children's Mental Health Bureau. Jim, you want to come help her with her USB?
Oh, sure.
Pen?
Maybe we'll hand out.
That's great.
I need to apologize right off the bat. I'm not contagious. I just have laryngitis, so naturally you can get it today.
No, I don't have it.
Just like people that have lots of stuff there. I don't know if you guys are like me, I like to have it in front of me. What did that person just say? So you look back, there's some good resource information in there.
Okay.
Sure. Yeah.
That's it.
Oh, thank you.
And then I'll just start this around too. And then let me turn it around so I can flip. I just know to change. You guys just stay there. Work that, I think. While we're getting that done too, let me tell you a little bit more about myself. I've been in human services since I was 21 years old, and I'm now almost 62. So I've worked in several different services, including developmental disabilities, independent living programs, chemical dependency programs, CPS, Child Protective Services. Sorry, I hate when people use those acronyms. And now I work for Children's Mental Health Bureau. So I feel like I've got a kind of a wide range of experience professionally. Personally, I adopted 2 children, one with some 504 needs, and I know exactly what you were talking about. And then the other one was mostly just child abuse and neglect issues. So she had some post-traumatic stress. And I'm proud to say today she is happily married to a wonderful man. I love him. She has 3 beautiful, my grandchildren. And she's doing really well. And she also works in the helping fields. So she did really well for herself. My little one still struggles, but she does pretty darn good for somebody who had the struggles that she has. So what I want to do was just kind of give you a little, oh,
The round button in the middle.
pushes me, okay.
Yeah, advance.
Okay. I just wanted to tell you a little bit about what the Children's Mental Health Bureau, what we do. Here's our mission: to support Montana youth and families in accessing effective mental health care to meet their needs. And you're the ones that we rely on, communities and consumer groups and schools. We try to partner with as many people as we possibly can. And the overview, I guess, for what we do for Medicaid is we're responsible for designing, developing, managing, paying for, and evaluating mental health services for youth enrolled in HMK Plus, which is Healthy Montana Kids. You guys already know that, but I'll just, don't like people who use those acronyms. So Medicaid, primarily youth with serious emotional disturbance. We always refer to that as SED, serious emotionally disturbed children. And non-SED kids get some limited services as well. Medicaid is a payer. We are not a placing agency. Sometimes people think we are not. We're just trying to help supplement and support however we can to help kids. This is basically, this is from 2011, so I apologize for that. I was trying to find up-to-date information quickly, so, but it's not a whole lot different than this. But as you can see, this is where most of our Medicaid money goes to.